Well, we've been talking to the group about, things that you can do to prevent your lower back from flaring up during the winter. What happens if you find yourself with acute lower back pain? What do you do then? Hi everyone, Dr. Timothy Gallagher.
Dr. Michael Marciello.
And we're from Maragal Medical.
Well, the acute injuries do occur regularly, so if you're taking all that caution to try to prevent you getting injured from shoveling things, you still may have slipped. There's iciness all over the place, so you could have landed on your elbow, you may have landed on your hip, sprained your wrist from landing and putting your hand out to try to stop the fall. So we think about all these things are acute injuries. We want to treat it as acute problems. Rest, ice. We want to take it easy, but there are some other things we do here in the office to really get people moving.
Yeah, and it's not just limited to the lower back pain. Of course, if you do find yourself flared up with a lower back episode, we utilize state-of-the-art technology like our lumbar decompression technique, which is a form of gentle traction where the doctor has the ability to gently stretch the spine. I know oftentimes, when patients look at chiropractic treatment as an option, that's kind of the last thing they want to have done when their back is flared up is have the chiropractor really work on their lower back. But the decompression provides a really nice way to just gently stretch out the spine as well. For the other injuries too, our class 4 laser does a really good job of decreasing pain and inflammation. Oftentimes we've been talking about, the dangers of using a cortisone injection. Class 4 laser is a completely safe modality. There's no pain associated with it. It's really quick. It just takes about, 5 or so minutes applied to the area where there's pain, inflammation, or actually joint swelling. And within about 9 visits, we actually see some significant reduction in those symptoms too. But medically, there's a lot of options because, we're not a chiropractic clinic, we're actually a medical practice that offers chiropractic treatment and physical therapy. So what about those medical options?
Well, without question, there's really simple things we can do to start. We want to make sure first we assess the joint, assess your lower back. Do I need to get some x-rays? Do we need to make sure there is no bone injury? We can look to see if there's bruising or tears. Even an MRI might eventually be needed. But at that acute stage, we start with some basic anti-inflammatory medications. I can prescribe some things or use some over-the-counter medications. We'll get the assessments to make sure there's nothing really that's harmful, and we can start conservative, start simple. If we think about ways we need to try to get more advanced, stronger pain medicines are necessary, well, we try to avoid those things. We really try to make sure that there's using the laser and there are techniques that we can kind of get you through those acute, painful days to get you started, to get you back on track without having any more complications to that injury.
Right, and if there is injection therapy needed, we do some pretty cutting edge injection techniques with PRP and those regenerative injections with the umbilical cord allografts to help repair and regenerate that damaged tissue. Having a physical therapist on staff really makes a difference because then we can offer the patient complete care. And guess what? It's a lot more convenient to come to Maragal Medical than sit in a waiting room at the hospital or try to get in to see the orthopedist, where we can manage those complaints right away and treat you effectively utilizing all of those services under one roof.
And just think about the muscles that tighten up around that acute injury. We do what's called a trigger point injection.
Exactly.
We just use a simple natural product to get into the knot, that tight muscle tissue, to break it up, allow movement to take place better. And that's a simple, very simple injection technique that gets that muscle calmed down along with the rest of the early treatment.
And you know what? Patients love the fact that we're always looking at holistic options rather than going for something that's a little bit more invasive. So if you'd like to learn more information about our clinic, please check us out on the web at maragalmedical.com. And don't forget, we're offering the public complimentary fall screenings. If you or a loved one have noticed that you're at risk for fall, or you've started to lose your balance, or if you've actually fallen yourself, we've got this state-of-the-art robotics technology called Hanova. We're happy to see you. Fill out the link below for more information about that. The assessment takes about 20 minutes to do, and right away you'll know if you're at risk for fall, and then we'll have the ability to talk to you about your treatment options to help prevent it. Again, my name is Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. We'll talk to you again soon.